Hello, everyone. We are live on LinkedIn. Uh, my name is Athena Hall. I'm a pediatrician and I'm the founder of Xena Health Network. It's a place where we can bring people from all different sectors together to change our healthcare system. Today, we're going to be listening to some stories from our guests here. We have Judy Berry, Althea Miller, Beth Boynton, Mike Herman, and Courtney Mansbridge. They're all going to be sharing their experiences with healthcare, the good and the bad, so that we can understand our healthcare system on a deeper level and move forward with a new vision on what we want our healthcare system to look like. So I'm going to start with Beth, if you would like to introduce yourself and tell us your story.
Oh, okay.
You are muted. There we go.
Now, can you hear me okay?
Yes.
Okay, thank you. Thank you, Athena, for calling us together. My name is Beth Boynton. I'm a nurse, consultant, and author, and I've been a nurse for almost 40 years. And I now teach improv as a way to improve communication and related skills. And when invited to share a story, a lot of things came up for me. Some of them involved things that were frustrating and stressful. The things that I think that we want to change, the chronic stress or bullying situations that I could focus on. I've had plenty of those. That's not the story that I want to share today, though. I just do want to put that on the table. But I remember a time, this is a story I want to share. I remember a time when working as a home health nurse, and I was called out in the middle of the night to see a woman who was dying. We didn't have hospice at the time. I think we probably called her terminal case. But I had seen her during the day and changed her. She had multiple dressings. She's had what we call fissures. And if you don't know what that is, it's sort of like a crack between your organs. And she had cancer that was kind of taking over her body. So there were places, I remember, in her thighs and her abdomen where she was leaking fluid, and we were putting colostomy bags on them to try to trap them. They smelled awful. They were a combination of things like pus and blood and feces even. And the poor woman was lying in bed and living with her mother, and the mother was the one that called me, and the others were leaking. So, and she had just had a blood transfusion a few days earlier, which gave her a boost. But obviously what was happening was that she was dying. And so I went back out to see her and worked on the dressings. And I thought, well, I think maybe I should call the doctor because, I needed help, and this patient needed help. What should we do with the situation? Because it was obvious that the leaking was going to continue, and just what an awful, place to be lying in bed like that for her and for her mother. And you don't typically want to call a physician in the middle of the night, but the oncologist on call was somebody that I knew to be collaborative and kind, and I called him. I shared the situation. He said, "You know what? I'm going to come out." And so he came out, and the four of us were sitting. Well, the patient was lying in bed, and he brought a chair and sat close to her, and I don't know if I was standing or sitting, but I was sort of with her mother, and he shared with her, if you want to get another blood transfusion, we can make that happen. It's not going to do much for very long. And what I remember, really, what's so vivid to me was the four of us sitting there in this middle of the night in this tiny little bedroom in this just very authentic, caring. It didn't feel good, but it felt real and it felt sacred. And I felt like, I'm sure that the doctor was exhausted. I know I was. Imagine the patient was and her mother. But so it wasn't like a good feeling, but it was a coherent, right, and safe feeling. And to me, that experience helps me to see what the privilege of our work in healthcare can be. And that's what I want to share with you today.
Thank you, Beth. Yeah, I'd like to open the floor after each story to hear what you're hearing from the story. What are your takeaways from what is working in our healthcare system and what isn't working? So does anyone, it sounds like, Beth, you said what you took away from that was the sacredness of that moment and the care that was being provided.
Yeah, as part of the good, it's people like that, right? People that are willing to go out in the middle of the night, that can really sympathize with the patient and understand what they're going through. That was my biggest takeaway.
Absolutely. Yeah.
And mine is too, because I did it a lot with the ranch, and it is important that at a certain point in time when you're caring for someone and they do go into the dying process, that you can be there present for them and be able to make their journey, or hopefully make their journey a little bit easier.
Yeah, I think of many stories like that because I work in oncology and have for a long time. And I think I just said that the other day. I was telling a story about being with a patient near the end of life and how sacred that is. I think one of the challenges now is just even more than ever, there's so much to do. And I think there's a lot of situations in the hospital where it's hard for nurses or doctors or staff to take the time to really sit with the times where, like you said, it doesn't feel good, but it feels real and it feels, important and powerful.
Yeah, absolutely. Yeah, we don't often get those moments when we're in the hospital or in clinical settings. But if it's created beforehand with an agreement with hospice, and having people around you in those moments, it can be really beautiful. And there are so many healthcare workers and so many family members who are able to be present with people as they're dying. And we want to be there for each other. So thank you so much, Beth.
Thank you for your feedback and listening. I think I just would like to just add that it's also important that felt powerful to me.
Yeah, thank you so much. Beautiful. Okay, so Mike, would you like to share your story?
Sure. Unfortunately, I have a very recent situation that happened. I was in southern Delaware riding one of these big electric scooters. Hit a speed bump. I was going maybe 10 or 15 and flew off of it. I hit, thank God I had a helmet on, because I hit head first and then I went down. And it turns out I broke 9 ribs. I fractured my pelvis. I broke the piece of the pelvis, the acetabulum. I'm not sure if I'm pronouncing it right. That supports the hip. In fact, my hip was out like an inch and a half. I punctured my lung, and I had, a multitude of other things that went along with it. So the good of this is the ambulance response. They were close. They got there quickly. They got me to the hospital. I don't really remember that part of it. And the hospital, the good with the hospital is once they did imaging, they saw the severity of it and said, this isn't for us. You need to go to a trauma 1 center. and they medevaced me up to the hospital in northern Delaware that was a Trauma One center. The good, again, back to nurses. I've never been in that much pain, right? Everything in my right side of my body is broken, and the nurses were just amazing. It's going to sound weird to everybody, but it almost felt like they cared so much that they took a tiny little bit of my pain on when they were doing things. They were just wonderful people. And then I went to the step down unit where, for the most part, things were worked out pretty well. I'll talk about one piece that didn't later on. So, the bad, one of them is I was laying on a stretcher in the first hospital. And so this was down by the beaches in Delaware, where they rent a lot of electric bicycles and such. And one of the nurses just made a comment like, hey, just another 60-year-old guy trying to be 25 again, riding these electric. And it was upsetting, right? Because to me, they're focusing on that and not on what the issue is. To their credit, once they figured it out, they got me out of there quick. There was no hesitation with it. The ugly is, so first of all, in the trauma step down unit, I was in ICU 5 days, trauma step down for 9. I was in pain, severe pain, and it was the day before a holiday, and there weren't a lot of nurses, and I was pushing and screaming and asking for pain med, and it took 5 hours because the NP, nurse practitioner, was on routine rounds and didn't break that for this thing. So that was really horrible. 5 hours. The only thing worse than pain is unnecessary pain. The helicopter, 30-minute ride to the other hospital. Anyone care to venture a guess on cost? Somebody.
Yeah, how about 50 grand?
200. I was going to say 200,000.
Right in between you two, it was $94,000 for this 30-minute ride. And then to make matters worse, first thing I got when I got back was EOB from our insurance company saying, your insurance only covers helicopter transport when medically required, so we are denying it. And I'm thinking, do I have to have an arm chopped off, or an arrow through my body to get to be considered worthy enough to have to take a helicopter up? Unfortunately, it's similar to 12 years ago when I was diagnosed with cancer. It was with an HMO, which is horrible even today because you don't get a choice of doctors. And we went in there and they misdiagnosed me and said, "Yeah, you just have vitamin B12 deficiency." And if it wasn't for my wife there, who's an RN, and I say my unfair advantage in all of this, pushing and pushing and pushing, he finally had us go and get some a bone survey, which is x-rays from head to toe. And I got an email from them saying, look at your website, or look at your portal. And I was so excited, right? Because nobody's going to tell you you have cancer that way. And I read it and I read it and I said, I was still in my mind, I knew it couldn't be. I was missing something. So I called my wife and she hesitated for a second. And that's when I knew that I had cancer. So, there's a lot to fix. I think my story illustrates, the failures in pain management, patient respect, insurance coverage, things like that. real quickly, that said, I got to live through an interesting time in cancer treatments. In the beginning, it was nothing but chemo. And at the end, it's nothing but novel therapies that are working phenomenally well. So that's my story. I thank all of you for listening.
Thank you so much for sharing, Mike. Yeah, I'll open it up for
Please.
reflections.
I just want to congratulate you, Mike.
Yeah, I'm so glad you're okay.
I had a situation where I was in a serious car accident, and the EMTs came and looked at me and said, "Lady, I hope you believe in God."
Oh my God.
I was just, so
That's-
when
that's
people
horrible.
don't think about what they say before they say it,
Mhm.
I have had that a lot. And what I did with the ranch for my talk was to do the best we could to take away all the negative parts of having dementia. You can't take away the progression, but
If I could add one more thing, and yeah, I have to look at it as humorous, but it really wasn't. It was a small road we were on. I'm laying on the ground screaming in pain. My buddy is standing behind me, and a car coming the other way just turned to block it. And out of nowhere, there was a car that pulled up behind us. This woman, probably in her 80s, walks up, looks at me, looks at my friend, and says, he's blocking the road. And in my past, I would have gotten so furious with it and wanted to strangle her. But now, you start learning what's really important and what you should focus on and what you should just kind of, let go of. So, anyway.
Yeah. Yeah. Well, it's incredible that the healthcare team felt like you needed that helicopter ride. You needed a higher acuity of care, but then the insurance company says, no, you didn't need that. And it was the providers in the hospital that knew that they weren't able to provide the care that you needed, yet the insurance company is the ultimate ones to decide whether or not
Yeah.
you'll be covered. And so that's really doesn't make a lot of sense.
No, it's like the fox watching the hen house, right? The people
Right.
who pay make the decisions, and I'm actually not concerned about it. I was on the other side of the advocacy thing, and it was very overwhelming in a good way. I can't tell you how many people reached out on LinkedIn and said, "Hey, this is what we do." I do fixed wing, but we do these help you with these denials. And he's like, oh, we'd love to do it for you. We're not going to charge. I probably got 3 calls like that about that, and a couple of messages about the other issues that came up. So there is a lot of good out there. There really is.
Yeah. There's so many people that want to help. So
One of the biggest things, excuse me, that stands out to me, there's lots of pieces of that story, but it goes along with the insurance decision, but also you were talking about your wife as an RN being your unfair advantage. And
Yeah.
I think of that a lot with healthcare, how there's been plenty of times where me as a nurse has been confused about advocating for a denial or figuring out how to get care from the right person and all of that stuff. And I just think, boy, if it's hard for us and we have knowledge of the system,
Right.
there's a lot of people that don't have that unfair advantage to get them the understanding they need.
And it's similar with my cancer diagnosis, right? We try and learn about cancer at the exact wrong time, right? I started learning about it at 51 when I was diagnosed with my cancer. And the only thing going through my mind was, oh my God, I'm going to die. And then after that, I was just furious with the world. It's not fair. I'm a good person. There's murderers and rapists living to 100. And My brain just couldn't wrap around it. And had my wife there, working on it, finding the best places, just help me understand, how to look for the best doctors and hospitals and such. So I'm very blessed to have that unfair advantage.
Yeah. When you're in that space, it's so hard to make those difficult decisions and to navigate a really confusing healthcare system. So I'm glad that you had that support.
Thank you.
Yeah,
I know I want everybody to have that kind of support.
absolutely. Yeah.
And Mike, I think, first of all, I'm glad that you've survived and seem to be functioning and thriving in your life. So yay, and thank you for sharing your
Thank
story.
you.
What comes up for me is just how complex our system is, because there's so many pieces, from the emergency response that worked, and the ambulance to get there, to get you to one emergency room, and then to make the decision to transport you to the other. All of the skills and assessment and technology involved in that, and the people, of course. And then there's that other side of the insurance company rejecting it, and a lady coming up and saying you're blocking. It's like these two different worlds, and I think we're seeing all sorts of that manifesting in our world today.
Yeah, it really is another world dealing with this.
Yeah. Yeah.
Thank you.
Thank you. Okay, now we're going to have Judy take the stage.
Oh, okay. My name is Judy Berry, and I'm a semi-retired senior, founder of the Dementia Care Foundation and the Lakeview Ranch model of specialized dementia care. My story is more, I'm not a nurse. I had no healthcare background. My mother was diagnosed with vascular dementia, and I was left to try to figure it out, and also after a time, to find appropriate place, because I was by myself and I was traveling for my job, and I wasn't wealthy, so I couldn't just quit. And the terrible stuff that happened to her during her initiation to, at the time in '86, was considered breakthrough memory care. And it became a nightmare for her. And she was put in locked units, and her dementia was still, actually, I should tell this because this is a little funny now, wasn't back then, that they put her in a nursing home because she had been in assisted living and went OD'd on her medications because nobody was paying attention. And she was in the hospital. I was called to come back from Texas or somewhere, and they discharged her. She obviously didn't die, but she was put in a memory care unit in a nursing home, like on the third floor. And she was scared. I mean, she'd never been put somewhere she couldn't get out of. And it was, for her, I can't even imagine the feelings of being trapped and not having a way to talk somebody into letting her do things. And so she was on this unit, and there was an elevator, and it had a paper over the push button, and she wasn't that far along. So she lifted the paper, and all of a sudden I get another call from this nursing home in a panic, because they told me she escaped. And that was like 10 o'clock in the morning. And they never found her for the whole day. But the funny part was that my mother was still, she used to make up stories like crazy once she got dementia. When she didn't know what to say, she'd make something up. So she had pushed the button and gone down to the basement, which had a meeting of local volunteers. And she went in there and convinced them that she was just another volunteer and that she was a little late. She apologized. And so she went through this meeting. When they were done, they all took off into floors of this nursing home to experience being with people. And at 5 o'clock, when other people were going home, they found her. But it was only because it was only 2 days that she was there. Not all the staff knew what she looked like. And she was able to talk a fake story, you know. And, but then they put her in the locked unit. And from there, she went berserk. Because once they told her that she couldn't walk out that door and that she was confined to this one aisle in the locked unit with a couple of rooms on either side. And the people in there were drugged, so they were pretty well non-existent. And she was just frightened to death. And they told her that this was going to be her life now, that she was never going to go back to the regular unit. And so, you know, to make a long story short, she started screaming and yelling and trying to hit the caregivers and to get out that door, to get back in with the regular population. And they put her back in the hospital and started a 7-year regimen of repeated psych hospitalizations where they were trying out all the different psychotropic drugs. And I could see every time she was hospitalized, and that was 15 times in 7 years for her so-called behavior. And I had lived with her. My dad died when I was 10. She had a breakdown. I lived with her for all these years. And so I would tell people that her unmet needs behind any behavior she had were emotional, that she was scared. She wanted somebody to pay attention to her, maybe somebody to just sit and hold her hand for a while and assure her that she was going to be okay, or that she was seen. But back then, I was told, when I mentioned that and told different people, they said, you're a family member in denial. She has dementia. Her brain is diseased and she's losing parts of herself every day. And then they told me that she didn't have emotional or those needs anymore, feelings, that I had to accept that she was no longer in there. And so for a layperson, and every time I visited her, I would see her eyes open and light up. She couldn't say who I was, or she, you know, was past that point and drugged to the point that she wasn't very verbal. And, but I'd walk up to her and her eyes would light up. I'd hold her hand, and within minutes, the tears would well up in her eyes. And she would say, help me, please. And that's all she could say. And I just couldn't stand the treatment that was given to people like there's nobody there. You know, you see them in some nursing homes, they're lined in wheelchairs up and down the hallway or in front of the TV. Nobody says anything to them hardly. You know, it's like they're just there as a piece of furniture. And so again, I could go on, but I'm just going to say that I was a regional manager for a barbecue ribs company. I traveled every week, and all these people would tell me, you don't have a healthcare background, you don't understand what happens with dementia, and you should go back to sell barbecued ribs. So I became so frustrated at 55. She had passed away 3 months before, but I went to my boss at the barbecued rib company and asked him about helping me understand how to start a business, which he did. And he found a bank that would loan me $1 million. I don't know how he did that, but obviously he must have had some connections. And I built a rural residential home on 11 acres. And I hired 4 RNs, knowing I didn't have any healthcare background. And but people who were tired of the system, and RNs that wanted change. I said, what we're going to do is take the people from the hospital psych units that are drugged, bring them to where we were. We built a residential home with a fenced backyard and animals. We built a barn. I had 35 miniature farm animals because I understood nonverbal communication, and animals do that automatically. So we did that, and I'm losing my train of thought. I'm sorry. But, and then, the nurses and I designed what we were going to do. I went out before we opened and took residents and found like a psych doctor that would believe in what we were trying to do. We were bringing those residents in, stopping the psychotropics, titrating them back over a period of time. And then it was amazing. You could watch these people who came in a wheelchair slumped down and drooling on themselves, and their personalities were coming back. And you could see who they were. I'm sorry. Okay, I'm done, I guess.
Yeah. Oh, that's okay. Yeah, thank you, Judy. Thank you so much for sharing that.
And we had fabulous outcomes.
Yeah, it's incredible what you created.
But it was not rocket science. It was just off what you saw happening to people.
Mm-hmm. Yeah.
It's a great example of finding a positive in even the most negative stuff.
Yeah.
Right. Your mother had this problem, and instead of just complaining about it, you said, I'm going to do something because I don't want other people to go through this. And I applaud you for that.
Mm.
Absolutely.
Well, my sons don't talk to me much because they're both doctors and they thought I was going through a midlife crisis, but that's been many years ago.
Yeah, I think it really highlights how oftentimes elderly are discarded in our healthcare system.
Oh, yeah.
Treated.
Well, I'm experiencing it now, being 81. It's not pretty.
Yeah, it's really.
I'm sorry.
Go ahead, Beth.
Yeah, I worked for a few years in such a locked unit as a charge nurse, mostly either 12-hour shifts or evening shifts. And what I love the story about your mother escaping, how creative she was, and actually how smart she was, and coping with the situation she found herself in that she probably couldn't process completely.
Yeah.
What I loved about that work was when you had the time and the staff to get to know each person, you could find out, you could discover what helped them to feel safe and what helped them to feel what were their special needs, and how you might help them feel more comfortable in that very strange environment.
Yeah.
I also remember standing in the hall wanting to cry because we didn't have enough staff, with alarms going off. And so I wish I could have had a job with you as an RN in your program. I think that because you discover how creative, and what I think when people have dementia, things aren't the same, yet discovering what's there and how to relate to people. I have many stories. And in fact, I just did a podcast with Jude Treader-Wolf, and we talked all about dementia and improv, and I will share that. I guess I'll maybe share that in the chat if I can, or with you later.
Yeah, or send me something on, to my email.
Okay, I'll do that, Judy.
Mm-hmm.
I just wanted to say, now I can actually talk. Haha, yay. I appreciate all the stories so far. I know I haven't said anything yet, but I just with your story, Judy, it's kind of like we underestimate dementia. We don't realize what it's all
Yes.
about truly, even though we think we do.
Mhm.
And I worked in home care. I worked in community for my entire career, and so I saw it a lot.
Yeah.
And people, it's behaviors, right? It's all a behavior. People are just like children. They're showing a behavior because that's the best way that they know how to express themselves, but we don't realize what's underneath of it, right? I saw something on LinkedIn and somebody was talking about somebody with dementia that they were acting out, again, a behavior, but it's because they had to remove a bunch of teeth. So it's a very interesting challenge that I feel that people don't still understand, and that they need to, in order for them to really help somebody with dementia.
Well, and I think I've learned by doing that people put people with dementia down by, especially if they're treating them as a child, or they take away from them any hope of being able to do things. We had families bring in their instruments after they were off the drugs, if they ever played an instrument regularly. And when they saw it, they asked what it was. They didn't recognize it. And our staff would put it, we had a guy with an accordion, she'd put it in his lap, and so he's sitting there holding the thing, but he had no idea, or he said he didn't. So she helped him put his fingers on the buttons or whatever those are that make them go. And within 15 minutes, he was playing. And his eyes lit up and he said, I didn't know I could do that. And by the time we were done going through our 15 residents in that house, we had a small little band going. And the biggest hurdle was that the families didn't want to bring the instrument because they thought we were nuts.
I think one thing that stands out to me a lot in your story, well, I just love the story too, that you took what you saw and made such an amazing place for people, but that we sometimes often forget that the person or their family are the experts in their experience. And we can't have the whole picture without believing what you know about your mom. If they had listened to that, they could have saved themselves and her a lot of pain. And I feel like that happens. I see that happen a lot.
Well, they drug
part
them
of my story later too. But believing that the people who know the patient or the patient themselves, that what they say is, at least try it out. Right?
And that's what happens is people that were in the healthcare system, which I kind of learned the hard way, we're kind of some of them in a tunnel, they'd been in it for years. They, just didn't think out of the box.
Mm-hmm.
They'd just tell me you're nuts. They can't do it.
Yes, absolutely. Yeah, thank you so much for sharing, Judy. It's a very powerful story. Courtney, would you like to share your story?
Sure. It's funny. I feel like mine's also a communication challenge as well, story, because different, but nonetheless. So my story is this. It's kind of a twofold story. So I had children. My first daughter I had, and I ended up being quite ill after having her. I was at home already, and yes, it was you. And she's here right now. And I ended up with a fever and chills and just not good. And so I went to urgent care where I live, and had they thought about the fact that I literally just had a child, having a piece of retained placenta would have been something obvious. Yet that wasn't something that anybody figured out until the next day when they finally were like, oh, we should probably do an ultrasound. And then they figured out, oh, hi, by the way, she's got a huge piece of placenta still stuck in her. And then on top of that, it was like, oh, well, we'll just leave it and let it, get out of your system on its own. Well, obviously, I already have an infection, so that's not going to happen. So I had to advocate very strongly. And thankfully, I had midwives and people on my behalf, but I had to advocate a new mom, just had a baby to get this placenta removed because, yes, I understand getting a DNC. So removing it could cause issues. I could bleed, but also I already had an infection and it's huge. So it's obviously not going anywhere. So that was the first part of my story. And then the second part was that I also have a second child now who's 3, who has had to have numerous hospitalizations because she's got asthma already. And the last instance was we went to the same place, urgent care, unfortunately. And she had a fever. She ended up with pneumonia, but she ended up needing, like, I want to say 7 meds. It was a lot of meds. And the first one, I held her down with the nurse to give her the Tylenol, but to the point where the nurse was putting it in her mouth and it was literally all over her face. And the nurse is like, sucking it up with the syringe. Also, just so you're all aware, I am a nurse as well. I do not work in pediatrics. I don't work with kids, but still, it was just like, this is not okay that you're having to suck it up and shove it in her mouth and do all these things. So the next medication that came up, it was like, oh, well, we have to get this in here. It was a steroid. And I'm like, I will take care of it. And the nurse was literally just like standing beside, wanting to do it. And I'm like, I'm good. I will. And within a few minutes that I explained to her, like, honey, if you want to go home, I know you don't want to be here. I know you're not feeling good. Like, and I ended up putting it in juice and she took it. But what I realized from all of these instances is communication is quite poor. And especially with kids, which, Athena, I know that you work with kids, time is not on our side and they don't take the time to actually listen. And everybody's very focused on, like, well, we need to do this. We need to get them better. We need to get these meds in them. Da, 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 da. It happened another time with her when we were in the hospital and she needed oxygen and I was asleep and they woke us both up to force oxygen on her, like a mask, and she ripped it off. And it's like, can we not have another option? Even though there were other options. So the challenges that I have personally faced, even as being a nurse, have been that lack of communication and not realizing that the person's voice matters and that you have to listen to the human that's in front of you.
Yes.
Absolutely. Yeah. Thank you for sharing, Courtney. Yeah, it's really tough when you have to really work hard to be an advocate and to get the care that you need, to get the care for the people in your life, and then also to have the care done in a way that is caring because the system is really pressures people to be really quick and efficient, so it makes it
and it does. And I honestly, in a way, I just think I'm so thankful that I am a nurse because I couldn't imagine trying to work through the system not having any medical background at all. And I know that I can see nods and I know that people resonate with that. But it's sad that I have to be a healthcare professional in order to understand the system enough to work through it, or have a healthcare professional, that I know. Like, it shouldn't be that way. It should be the fact of it's a mutual system. We are there to get the help we need, but also to be worked with, not worked against.
Yeah.
Well, and I've learned, not being a healthcare professional, in my decision to try to do something different, that you have no support and people focus in on the fact that you don't have any experience. And what we did was not rocket science. I mean, when you see somebody acting out, the first thing I understood was you can't let it get out of control where we have one lady throw her dresser drawer through the window. But when we first started, but you have to prevent, and so as we're taking the psychotropics off, everybody has called family and knows all about this person and is developing that trusting relationship. And then you get to understand when the medication's gone, you can see the nonverbal and you address that immediately. You validate.
Yeah. And you mentioned about not treating them like kids, and I agree with that. The other part to it though is they are fearful because they don't understand what's going on, just like children. And when kids can understand what's going on, I'm not saying they always agree, but when they can understand, just like an adult, or if somebody has dementia, they're more willing to try things out. Like I can see a difference between my 6 and 3-year-old. My 6-year-old, even though she says no to stuff still, she at least can understand it versus my 3-year-old that's like, I don't know what's going on and I'm scared and I don't want to do it. Especially when they're sick.
The only
And
thing
so
I've
it's that.
learned- Oh, go ahead. I thought you were
Oh
done.
no, it's that education piece, right? It's that education piece to know that you have to do those things. And yeah, time's not on our side, but you need to take the time. Like
Yeah.
yeah.
I did learn, though, that one of the biggest issues with a senior person with dementia is to feel talked down to. And that's going to cause, anytime you even call them names like honey and sweetie, or,
Oh yeah.
or try to treat them like you would a child, they know it. I mean, they may act like they don't know anything, but that's a feeling. And they feel attacked. They feel disrespected, and they will have behavior. I mean, we found that to be so much a part for some of the, we had 430 residents in 20 years that went through our place. And only one in 20 years that had to be rehospitalized. And they'd all come from hospital psych units. And, I have no idea what the cost of that is, or the savings of that is, but I know from a personal thing, a hospitalization for someone with dementia is horrible. I mean, I don't know how to put it medically, but
Like being in a prison.
yeah.
Well, they're out of their routine, right? They're out of it. That's why I say it's not that they are a child by any means. And I'm not saying that we need to treat them like a child. I'm saying that the same principles of a child and somebody with dementia are there, right? A child is scared because they don't know what's going on, because they haven't been given the information to their level of knowledge. Just like somebody with dementia is scared because they haven't been given the education and the knowledge to their level of where they're at. When they take them out of their routine, just like a child, they're upset because they don't know what's going on. It's a lot of fear, right? And if we would understand those things and really meet people where they're at, regardless of what their diagnosis, their age, all that stuff, just meet them where they're at and individualize that care, then we'd be probably having a lot less behaviors and we'd be able to help people a lot better, is where my brain goes.
That can be tied to trauma-informed care as well.
100%.
And
Yeah.
I like to call it human-centered care, where the person is the center of all of it. I think one thing that I just kept thinking as you were talking to, kids also can tell when they're being talked down to, at least many of them. So I have kids that are very sensitive to that, and they would, one of my daughters was so anxious about injections. Actually, injections, but also the one I'm remembering is a COVID swab. So it was terrifying to her, and it took time. We were going through a drive-through. They wanted us to keep going, but I was like, you can't hold her down and stick it up there. It's not going to work, And so, the person trying to convince her kept kind of talking down to her, like, oh, come on, be a big girl, you need to do this. And later she was like, Mom, I knew I needed to do it. I wanted to do it. But then, the more he said that, the more she was like, I'm trying, just give me the chance to use my coping skills to get ready to do it. And so I think, yes, just all around, really focusing the person in the middle of the care.
I think it comes down to connection as well. Are they really trying to connect with that person? Yeah.
Agreed.
Okay. Yeah. Thank you all. Althea, would you like to share your story?
I would love to. So my story is about also not being listened to and being listened to. So it's related to a little different topic though. So I have two teenage daughters, and as they were growing into their teen years, and they started, they were on TikTok, whatever, they started seeing autistic women sharing their experience. And they said, "Wow, mom, this is describing my internal experience. Like, I think this is me." And so they did a lot of looking into it. We did a lot of looking into it together, kind of figuring out what are the internal symptoms that aren't so stereotypical. And so we wanted to get them evaluated because they both felt like they would feel better with an actual diagnosis. So we went to, this is specifically about my oldest daughter, although it took both of them more than one assessment to be truly seen. But we took her to a psychologist who specialized in twice exceptional people. So she's very gifted intellectually, but then also with the disabilities. So I thought, great, he's going to understand that a lot of this is masked, and she might be able to look very neurotypical in when she just meets you, and yet hear all the experiences underneath. So of course they do an interview with me, and I went through all of our reasonings and explained the internal versus the external, all of this. And then we had our results meeting, and he was like, "No, I don't think she can be autistic because she was doing eye contact, like she made eye contact with me, and I didn't see a lot of stimming and some different things like that." And I asked him, "Well, what about the internal experience? Like, she reports it's very uncomfortable to make eye contact. She counts in her head like how long is the right amount of time to make eye contact." But he was like, "Well," and really didn't respond to my concerns at all. And so it felt so dismissive. And once again, so then I shared with her, like, I don't think that he saw these things. I think you need to trust yourself. But she started feeling like, well, okay, he says that I'm not autistic, then maybe my noise sensitivity is just me being too sensitive. Or maybe like me asking for accommodations about this, like I'm just trying, I should be able to figure it out. I should be able to do it. And it was really difficult. So we found along the way a nurse practitioner who, from the first 5 minutes of our first virtual appointment, I said, "She sees you. She sees us." I didn't have to even, like, she brought up things before I would mention them, and she would ask those questions that would reveal the internal piece of it, and the masking, and the presentation that's not the stereotypical white male boy presentation. And that feeling was like, I just can't even really describe that feeling I had when I was like, she sees my daughter. She like, and then so we did an evaluation with her, and even her report was just so affirming. She saw the beautiful pieces of this different neurotype, and she of course shared, she sees the challenges living in this world with a neurotype that's often misunderstood, and not necessarily, the world's not structured for that. But even in that, and in her accommodation recommendations and all of that, was so affirming to my daughter. And I could just see a new, relief since that diagnosis, that, okay, I do understand myself. There's a reason, when I'm getting really overwhelmed, it's fine to put on my headphones and go to another room, even if we're in public or I'm supposed to be being polite, or, just the difference there of understanding the person, looking beyond just the outside, but then also like staying current on what's out there, because there is a lot of information out there now about different presentations of autism. And this expert that I thought would really be able to understand wasn't current on that. And so anyway,
Yeah.
that's my story. And we got to experience both sides. And I guess what I said as well with this is, I had done enough research, and as a nurse, and as a person that loves to dig into things, like I was able to say this doesn't match up, and I felt confident enough to say, I feel like we need to pursue more versus just accepting the first evaluation. But many people wouldn't. They wouldn't have that knowledge, or they wouldn't have the confidence. They would think, well, this professional obviously knows what is what. And so just once again, the privilege, also the privilege of the fact that our insurance covers these evaluations completely. So we could do another one without having to think, how are we going to scrape together the money? There's just so many pieces of that, the layers of the healthcare system that are barriers to many people in getting the care that they really deserve.
Absolutely. Thank you so much for sharing, Althea. Yeah.
Everything about that speaks to me.
Yeah.
And like, I got
Me too.
late diagnosed with ADHD, and I may have autism, and just you going to somebody who's supposed to be a specialist in it and not knowing that that's sometimes how somebody can present, that they mask and all these things, and like having my two kids and the teachers not knowing it either, saying like, oh, well, I don't think, and this and that. Like, do you really know what how it presents itself? And then my 3-year-old maybe now having ADHD because the pediatrician is thinking she might be, like, it's just, there's just so many pieces to that just like,
Yeah.
I mean, I feel for you, and I also am just like, it's just, why are we still here? Like, how is this still
Well,
a
and
thing?
I could talk a lot longer because in the last 5 years, 5 members of our family have been diagnosed with multiple neurodiversity and learning disorders that I suspected, several of them I suspected for a long time, but also kept being told, and sometimes legitimately, the struggle. I understand that like teachers and people were trying not to over pathologize,
Yeah.
some of the struggles, but yeah, things that we have. I could have about 10 stories similar to that one.
But that feeling that you had when you felt heard and your daughter felt heard and seen, that's really remarkable. And I'm so happy that you had that experience and you were able to advocate for that, and you had the privileges to be able to access that. And yeah, that's what we need more of, absolutely, in our system.
Makes a huge difference when you can finally find somebody that actually, believes you and listens. Like, we finally found a pediatrician for my kids that will deal with the constipation stuff with them. And, this is the third, I think, pediatrician finally that's like, we will go to all lengths to try and get this figured out, right? Versus ones that were like, here,
Same
have
thing with one of my
Restorlax, or
kids.
for you guys it would be Miralax, right? But have this powder and all will sort itself, when it's like, it is so much more than that. So yeah, right, like it is truly amazing to finally find that. But that's the reason that I'm frustrated, is because, like, why is it that we have to go through all these lengths, go through multiple physicians, especially when it's your kids, that they have to wait through all this stuff to find somebody, right? Like, that's not how the healthcare system should be, even though I know that's how it is, but it's frustrating.
And yeah, once we found this nurse practitioner, we drove 2 hours to see her.
Yeah.
2 hours each way, so 4 hours once a month to see her in person, because it was just that meaningful to my daughter.
Yeah. But that's why I say it shouldn't necessarily, that's, to me, that's not necessarily okay, right? Like, and I'm sure you agree, right? And I'm sure we all can agree on this phone call that, like, we should be able to find these resources near us, be able to find them in a timely manner. I mean, I don't know how long you had to wait, but I know even where I am, like, I'm in Canada, and the wait for a psychiatrist, for a child psychiatrist alone, if they're a good one even, is a year. and like that's unreal to me. So, you know, having to wait, then finally finding one, and they're 2 hours, like it's all, yeah. Anyways, I know we have time, but yes, or sorry, we don't have time, but anyways, yeah, it's frustrating.
Well, I want to just add a couple of things like that. That's what stood out to me too, Althea, was that almost overwhelming feeling of, I don't know, gratitude and feeling cared for and feeling heard and respected. It builds this foundation of trust with the person that's caring for you when you're vulnerable. It's so vital. And all of these communication threads involve these soft skills, like even with the physician, I'm just, I'll guess a little bit and generalize, to not be able to say, I don't know as much as you, because you have a child and you're you're researching every day. So you might know something that I don't know, and to feel confident, that's kind of like a self-esteem, self-confidence thing. That's part of emotional intelligence. That's part of that soft skill umbrella, that if we can improve, I just get on a real soapbox about improving those skills so that we can build healthier relationships with our patients and with the people that we work with. It's so important. So I'm glad you found somebody that you could connect to, and I'm sorry that you have to drive 2 hours like Courtney was saying. It shouldn't have to do that.
Yeah. Thank you, Beth. That was really beautifully put. Yeah, so thank you all so much for sharing your stories. It's so important for us to listen to our stories so that we can move forward in a new direction in our healthcare system. We need to be able to connect with each other and understand the deeper issues. A lot of what's happening in our healthcare system with innovation and reform is on the more on the outside of the system, and not really getting into the foundation of what our deeper challenges are. And I feel that the only way to really move forward with a healthy system is to take a deeper look at that foundation and build something that is truly supportive for everyone. So the common thread that I heard in all of these stories was some of the challenges were the need to either have an advocate or be an advocate in a time of difficulty. So you might be diagnosed with cancer like Mike, or have your daughter that you really need to advocate for, with Courtney and Althea. You have to be able to really push and advocate for people in your life. So I think I could envision a system where we actually have advocates within our system that are helping us navigate, helping us to understand how to move forward in the system, as well as connecting us with the resources that we need. So
Very true.
Yeah. So that's something I envision for our system, based off these stories. And then, as well as another challenge that I heard through these stories, is there's a focus on efficiency and just kind of getting things done, seeing people as problems to fix quickly. And I think moving forward, as we envision a new healthcare system, we need to shift towards developing these skills and putting more importance on emotional intelligence,
Yes.
connection with people, and having a human-centered healthcare system. Yeah. And then the third thing that I heard was Mike mentioned, and a lot of people mention, is the cost and the access to care. So that can be a huge challenge in our healthcare system. So moving forward, I would like to see in our healthcare system where it doesn't matter who you are, if you're whatever race you are, whatever class you're in, if you have very little resources, or if you live in a rural area, you're able to access the care that you really need. And that's something that is a priority in our healthcare system. So I want to open it up for you all to add your reflections.
I feel like you hit everything. Like, I feel like you hit everything with all of that. I think that, the system, I mean, we know the system is broken. Is it fixable though? Yes. And there are certain things that need to be fixed, right? Time is precious, but we also do need to take the time to do things. We need to communicate. We need to look at the person that's in front of us and not just think that they're a one size fits all. I love, Athena, that you were able to look at all of our stories and see the similarities in all of them, and really realize that that is the thing. There are similarities in all these stories. Whether it was a positive or a negative story, there are similarities behind it. A lot of the thing is we didn't just quit. We didn't just let it be. We continue to advocate, all of us, in different ways, because we know that there is better. But there are so many people out there that don't, that they just still listen, and it's like that. There needs to be a shift to open up that door for people to feel comfortable enough to say how they feel and to say that they want better. I think it's happening with the next generations, but I do think that that's something that needs to be there.
Yeah.
I would just like to add one quick thing, and that's that what I've seen over the years has been that there's a huge change in the healthcare system and what's important to the people that run the healthcare system, and that's money.
Mhm.
All of us talked about the person and what it feels like and all of that. It doesn't matter a lot of times, because everything that I tried to do earlier on was met with that costs too much. And somehow I wanted to get out and punch people.
I think, yes, that is so true. All of the pieces. And I think a few things that I would love to see is, one, in the people making the decisions about what's important to a hospital or a clinic or to a healthcare system are not just the administrators and the people that control the money, right? It's the
Very
people at the
definitely.
bedside. It's the people that are being treated, all of that. And then also, one of the things that I think that my goal is to start with, because I feel like I can actually make a difference in that right away, is supporting healthcare workers that are at the bedside to have the space and the skills to do that human connection. We can't, we can't fix the whole system right away, but if we can, each one of us helps a few more people see the people in front of them, it'll spread.
Mhm.
Absolutely. Yeah, thank you. What I loved about Beth's story, her starting us off, was that human connection. And we truly have so many people with huge hearts in our healthcare system who want to connect and they want to help other people. And we have a plethora of people like that. But the way that we've been trained and how our system works can make that connection challenging. So just offering that support, like you said, Althea, so that is possible, and not putting so much emphasis on efficiency, but also really prioritizing that human connection.
I learned early on that saying, I don't know who quote or who did this or said it, but it's not how much you do for me, it's how you make me feel.
Yeah, I've heard that. Is that? I'm blanking on who that is as well. But I know the part you're talking.
I just
Tony Robinson, maybe? I don't
No,
know.
It's a woman. Yeah.
Mm-hmm.
Yeah. And I need to scoot out in a couple minutes. I just want to thank you, Althea, for pulling us together, for having a vision and taking an action step.
Yes.
And each of you for bringing your story. I think one of the things that feels vital to me is that, there's healthcare and non-healthcare, or playing a role of healthcare, or a mom, and we're here together. And I think it is our healthcare system. And if we can build more of a collective voice and listen to each other, that feels like an important step. So thank you all for listening to me and for sharing your stories.
Absolutely. I love that. Thank you so much, Beth. Yeah, so our vision for our healthcare system is a human-centered healthcare system that prioritizes connection, one that advocates for the people working within the system, as well as our communities who are trying to access care, and a system that looks at the whole person. And yeah, I think that's our vision for our healthcare system, is human-centered. Yeah, so thank you all so much. I loved hearing your stories. I appreciate you sharing.
Thank you.
Okay.
Thank you, Athena.
Yes, thank you
Thank
for having
you.
us.
Absolutely. Have a wonderful rest of your day.
You too. Bye.
Bye-bye.
Bye.